Alrighty. I think everyone should see my screen and we are recording. So, hello everyone, my name is Kara Partridge. Welcome to our recording today. Today we'll be going over MedChem basically, so mechanisms, classes, structures, formulations, CAM, and supplements. I would like to give a big thank you to Anthony McDonald for his work on this PowerPoint because he basically created the backbone for this PowerPoint last year. There's not a lot of changes from last year to this year, so he let me take his PowerPoint and make some minor edits and adjustments. So yes, thank you to him. Just a couple of reminders. So these materials are online, and this is intended as a review. And then feel free to unmute yourself and ask pertinent questions or clarifications, and you can always email me. And I did not provide objectives because I hope you know everything for the exam. So this is the agenda for today. I did provide the page numbers that are in the RX Prep 2021 book. So I did update what we have from the 2021 book. All right, jump right into it. So chemical structures. So this is, so we can expect the effect of a drug from its mechanism of action, chemical structure. And so we have the structure-activity relationship. That's what it's also known as. And so functional groups allow pharmacists to predict certain effects or adverse effects. And so the biggest, I guess, example we can look at are sulfonamide groups. And so that would be a sulfa allergy potential. So over here on the right, this is what that sulfonamide group looks like. An example of that would be in sulfamethoxazole. And so I highly recommend committing the structure to memory right here. And so with these chemical structures, we can predict allergies and contraindications. So in this one, we have a couple examples. We have celecoxib, procaine, and lidocaine. So on the left, celecoxib is actually contraindicated in those with a sulfa allergy because it has the sulfonamide moiety. Reactions are common in local anesthetics. And so if a patient has a reaction to procaine, other ester type locals such as benzocaine should actually be avoided due to the potential for cross-reactivity. However, it is reasonable to try an amide type instead, such as lidocaine or bupivacaine. So in the center, we have an ester type anesthetic. And on the right, we have an amide type anesthetic. So the amide type anesthetics have an I in their name. I believe it's like right here in their name to help differentiate. So we have lidocaine, bupivacaine, and ropivacaine. And then procaine, I think it's like has the O in it as an example. Sulfonamide, there's the ester, and there's the amide. So now we get into the pH neutral groups. And so here they are here. And so this first one, we have the hydroxyl or the alcohol. We have a ketone here. Aldehyde, so that is the O with the H. Amide, we have an O and the N with the H2. Nitrate, we have 3 oxygens with the nitrogen in the middle. Nitro, there's 2 oxygens with the nitrogen in the middle. Aromatic, also known as a benzene ring. Urea, we have 2 nitrogens and then a middle one with a carbon tied to an oxygen. Carbonate, we have 3 oxygens with the central carbon. Carbamate, we have a nitrogen, central carbon, and then 2 oxygens. Ether, we have a centralized oxygen with a couple carbons coming off of it. And then a thioether, we have a centralized sulfur group. And so I don't know about you guys, some of these are kind of hard to remember, but for ether, I think ether this or that. I know that's really silly, but that's what I think of. And then for nitrate in carbonate, there's always 3 things coming out, 3 oxygens coming off of it, and I think of I ate 3 meals. So I'm not sure if that helps you guys or not. So now we get into the pH acidic groups. And so here they are. We have a carboxyl, a phenol, and then imide, and a sulfonamide, which you've already seen. Carboxyl can also be known as the carboxylic acid. We see that a lot. Here are the basic groups. So let's see if we go back. We'll see that in a lot of those pH acidic, we have those oxygens. In the basic, we have a lot of the nitrogens. Just something to point out. So primary, we have 1 carbon coming off of the amine. Tertiary, we have 3 carbons coming off. Here we have an imine. Here we have an amidine. Let's see here. Let's move on. So here's a commonly used structure. So here's a beta-lactam ring, and so that's in the middle right there. Let me turn off my note page. And so contained in the beta-lactam, so this is contained in the beta-lactam antibiotics. So for example, amoxicillin, so we would see it right here. Ertapenem, we see it right here in the structure. And then ceftriaxone. However, aztreonam is a monobactam antibiotic. So beta-lactam, it's not connected to another ring like you see in ceftriaxone, amoxicillin, and ertapenem. So it's not cross-reactive with the other beta-lactam antibiotics. However, these other ones are cross-reactive to other drugs with a beta-lactam ring, just of note. Here are some other structures. So both NSAIDs, aspirin and ibuprofen, contain acidic carboxyl groups, so right here on the edge. And then amphetamine has a primary amine right here. And then acetaminophen has an amide, a hydroxyl, and then an aromatic benzene group, or benzene ring. MedChem is coming back to haunt us. All right, going on to some other structures, just kind of zipping through. So levothyroxine, so this is a thyroid hormone. So this is where we have these iodine coming in there. So it mimics the T4, hence why it has 4 iodine molecules, and it's actually converted to T3 in the body. So when we see the structure, if it comes up on the exam, if we see 4 of those iodide or iodine, molecules there, T4, and if there's 3, then it's T3. Amiodarone, so this is a class 3 antiarrhythmic, and it contains 2 iodine molecules, and we can think of this because IOD is in the name, so that kind of gives us a hint. And this actually explains why it can have the hyper and hypothyroid effects, and it's actually contraindication in patients with an iodine allergy. So that actually helps us. Helps us with MedChem and side effects, so that's cool. So fenofibrate, this contains ketone groups, and then it's for high cholesterol, so that's good to know. Amitriptyline, this is a tricyclic antidepressant, and let's see here, tri is in the name, so that helps us. And then chlorpromazine is a phenothiazine antipsychotic, and it contains a thioether group. That's right here. Okay, so that was really fast, but that was some MedChem for everyone. So now we're going to move into formulations. Okay. So for formulation considerations, cost is always a big deal. So compressed tablets are the least expensive, but capsules are also relatively inexpensive. We also want to think about applicability. So is there a need for a different type of formulation, and who would benefit from a different formulation? There needs to be a benefit to the patient for the higher cost formulations to make it worth it. And so if you're unsure if a specific formulation exists, ask yourself the following questions on the NAPLEX. Who typically uses this drug, and would there be a reason to have this type of formulation for that patient population? So formulation variability, as an example, olanzapine. So this is an antipsychotic drug with multiple formulations. For example, it's an immediate release tablet. They have an orally disintegrating form, short-acting injectable, and long-acting injectable. And who uses it? Patients with schizophrenia, bipolar disorder, or some other type of psychosis. And so why are those different formulations beneficial? Well, long-acting injectable, this might be good for adherence. So patients will often discontinue. Well, that long-acting injectable can last for a period of time. Short-acting injectable might be good for acute agitation, to have a fast onset. And then the same thing can also happen for the orally disintegrating tablet, which is good for people who want, for those who do cheeking. And that's when people hide the medication in the mouth and then spit it out when no one is watching. So it'll dissolve quickly to prevent that. Another example is on Dancitron. So that's our serotonin antagonist for nausea and vomiting. So we have the immediate release tablet, the solution, orally disintegrating tablet, a film, and then a short-acting injectable. And then of note, we also have a patch for the granicitron. Who uses this? So patients receiving imidogenic drugs, like in chemotherapy, post-surgical patients, and then patients with a condition causing the nausea or vomiting. And then, so different formulations are beneficial because we have the active vomiting, so we don't want to vomit it back up, and then, it doesn't work that way. If we have swallowing issues, loss of an oral route, painful esophageal ulcers, strictures, or tumors. So, and then going back up to the granicitron, so it's a long-acting patch and it's applied before chemo to begin having its effect, and it can prevent chemo-induced nausea for up to 7 days, actually. So that's pretty cool. And then just another side note is that oral solutions are preferred over crushed tabs for nasogastric tubes. Moving on to sweeteners. So many formulations are exposed to our taste buds, and so they have to contain sweeteners. And for example, those would be aspartame or saccharin. And so generally, these are well tolerated, and some of those exceptions might be sorbitol, because they might produce gas, cramping, and bloating, especially in sensitive patients like with irritable bowel syndrome, and then phenylalanine. And so those can be used in orally disintegrating tablets, the chewable or granule meds, and then that can be dangerous in the PKU. And then lactulose, it's the most common excipient in there, and it's not tolerated by everyone. And additional information about that is in the non-sterile compounding chapters. But so PKU is a genetic defect in which the enzyme that degrades phenylalanine is absent. So that's just another note about formulations. So now we're going to talk about some of the more oral route stuff in formulations. So orally disintegrating tablets. So these are placed on the tongue and they rapidly disintegrate in saliva. There's also films that dissolve in the mouth, and those are similar. These are some examples listed here. And these are the reasons for use. So dysphagia, children who might not be able to swallow, nausea, and then non-adherence. We also have sublingual or buccal, and some other examples are tabs, films, powders, or sprays. We also have some more examples here. Reasons for use, and they're kind of the same thing for orally disintegrating tablets. And so we have a quick onset of action. So sublingual, they get to the systemic circulation faster if they're under the tongue because of that blood supply right there, rather than being on top of the tongue. So I often like to tell my patients, if they're getting on Dancitron, to put it under their tongue. and then less of the drug is lost due to gut degradation and first pass metabolism. We also have lozenges and troches, and then yeah, sometimes we can treat conditions in the oral mucosa, so it's like actually treating stuff locally. And we want to hold the drug there to slowly dissolve. And then, of course, chewable tablets. And so we have some more examples here. And then like aspirin would be there too. So this is usually used for children who are unable to swallow tablets. Yes. All right, some more formulations for the oral route. So granules, powders, or capsules that can be opened and sprinkled into soft food or water. So a lot of these have actually some really special instructions. So for Creon and other pancreatic enzyme products, I wanted to point out, it says soft food with a low pH, applesauce, pureed pear, banana. Some of these say non-carbonated liquid. Some of them say pudding, you know, spoonful of applesauce, carrots, rice, or ice cream. So you have to look at the package insert for some of these. They're a little bit different. But a lot of them are for some of our special populations like geriatric or pediatric patients who have difficulty swallowing. Also have to look at these nasogastric tube patients. Let's see here. So yeah, always refer to the product labeling for instructions. So not all the capsule medication should be opened and administered. Medication should only be mixed in the specific foods and liquids that were studied because of the pH of the food and liquid. That could be critical. And many medications have specific instructions for oral versus nasogastric tube administration. Right, so long-acting tablets and capsules. So we have a lot of those do not crush and do not chew list. And then we also want to take note of those osmotic release oral system ones, and those are the ones that can cause those ghost tablets in the patient's stool. So telling them, you know, don't be alarmed if you see that in your stool. It's still having its effect. Don't be alarmed. And it's not, let's see, it is dangerous if they are crushed. So let's see. No other notes on that one though. All right, moving on to nasal. So we have some nasal sprays here. Some new ones are coming out. I believe there should be, correct me if I'm wrong, I think that there's going to be a nasal insulin soon. Not sure on that, but always new medications every day, it seems like. Reasons for use though, so it has a faster onset than the GI route, and it's useful for acute conditions that need to be treated quickly, including pain. And they do bypass gut absorption, proteins that are destroyed in the gut, like calcitonin, and that can be delivered nasally. And some patients may absorb drug better nasally if they lack intrinsic factors needed for absorption, especially for vitamin B12. And of course, some of these are used to treat localized nasal symptoms. All right, now we're moving on to topical. So creams, ointments, gels, and solutions, and these are mostly for localized effect. Here's some examples. And they're usually for muscle and joint pain, cold sores, acne, eczema, inflammation, etc. And we also have topicals for systemic effect as well. For example, testosterone. All right. And then we have rectal, so suppositories and enemas. And again, this is something that can be used for local treatment or systemic effect. And I believe this is one of those things where a certain segment of the colon is for local and a certain segment is for systemic. So I'd have to review that to regurgitate that to you, but that'd probably be worth reviewing. All right, now we move on to injectable. So we have subcutaneous injections that patients can self-administer those are mostly subcutaneous. We also have long-acting injections that are intramuscular, and then we have intravenous injections. We have some examples here. And then reasons for use, so subcutaneous, usually used for rapid effective drugs that would get destroyed if not absorbed, if given PO, sorry. And then IM injections, so various drugs come as long-acting injections to improve adherence, such as antipsychotics, like we discussed before, or to decrease the need for more frequent or painful injections. And then IV injections, so these bypass the oral route for patients who are intubated or sedated. These also have a fast response and can achieve high drug concentrations, also avoid loss of drug due to nausea and vomiting. These are some of the common sites for self-injecting, and then some of the refrigerated drugs, so good to look back on and refer to if needed. And then here's some good frequently asked questions about patches. Can we cut the patches into pieces? Usually no, except lidoderm, which is designed to be cut and applied over painful areas. Can it be exposed to heat from electric blanket, heating pad, or fever? No, because this causes rapid absorption from the medication, which can result in toxicity and can be fatal. The patch is bothering my skin. What can I do? Alternate the application site, avoid shaving, instead trim the hair with scissors, and you might want to use a topical steroid after the patch removal as needed. When the patches, or which patches need to be removed prior to an MRI? The ones that contain metal or aluminum to prevent burns to the skin. So here's some examples. The patch doesn't stick. Can it be covered with tape? Most of them can't, but a few patches can be covered with tape around the edges or with an approved adhesive film dressing. So some of them actually come with their own tape. And then disposal. So this does vary by patch. So usually you can remove and then press the surfaces together for disposal. So Duragesic and Butrans should be flushed to prevent accidental contact or toxicities, or having a family pet or child ingest them. Here's some additional information on patches. So they can irritate the skin. Don't apply to oily or irritated skin. Some patches, though, yes, they are applied directly to the pain. That's what they're for. Again, this is clipping or trimming the hair. Try not to shave because that could cause more irritation. Smooth pressure for 10 to 30 seconds and alternate sites. And then this is really nice to show kind of where they're applied. All right. So getting into the dietary supplements, natural and complementary medicine. So a little background. Complementary medicine is defined as non-mainstream health practices used together with conventional medicine. Alternative medicine is used when conventional medicine is not used. And then natural medicine is a general umbrella term that includes herbals or plant products, vitamins, minerals, and many other non-plant substances. For example, glucosamine, which comes from shellfish. So for example, most Americans with cancer use conventional chemotherapy, and many use complementary approaches to manage side effects and promote healing. And in the last decade, yoga and meditation have had the largest increases in use. So for dietary supplement regulation, the Dietary Supplement and Health and Education Act, or DSHEA, of 1994, they require the manufacturer to ensure that their products are safe before being marketed. Drugs must be shown to be safe and effective before being sold. And then the FDA was tasked with showing a dietary supplement is unsafe before taking action to remove it from the market. And then this act said manufacturers of dietary supplements cannot make claims that the product treats or cures a condition. They also said that they require a warning that states this: the statement has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. And then they also require to follow the good manufacturing practices, though many do not. So rather than claims of treating or curing, health claims are limited to nutrient content, the relationship to health, and the impact on normal body structure or function, such as calcium builds strong bones and fiber maintains bowel regularity. So they're kind of beating around the bush and kind of getting you to the point where, they're manipulating you, I guess, in a way to, think how they want you to think about their product, you know, to get to this point without saying what the FDA doesn't want you to say, or. All right, so some interactions with prescription drugs. So a big thing that we see with these CAM and supplements. So a lot of these natural medicines can interact with our prescription drugs. Induction or inhibition of metabolic enzymes and drug transporters is especially seen. So for example, St. John's wort, a big inducer of CYP3A4 and PGP, as well as CYP2C19, CYP2C9, and CYP1A2. So this is something that we want to avoid the use of contraceptives, transplant drugs, and warfarin. It is serotonergic, so it's not something we want to use with MAO inhibitors, linezolid, SSRIs, and SNRIs. And it does cause photosensitivity, so we want to have our patients be protected in the sun. And it might lower the seizure threshold, so caution in anti-epileptic drugs in patients with history of seizures. So dangers of herbal supplements. So increased bleeding risk. So especially in combination with other risk factors. So the prominent offenders I have listed here would be the 5 Gs. And so we have garlic, ginger, ginkgo, ginseng, and glucosamine. And I wanted to mention here, so when you think about the 5 Gs in terms of how they affect warfarin too, I think oftentimes, so green tea is not included, but that's something that comes up, but that kind of has the opposite effect. So in that it causes more of a clotting risk. So think of it in the terms of when someone is eating greens, think in terms of green tea being grouped together with greens, in that there's more vitamin K, and so it might have more of a clotting risk, so less of a bleeding risk. So anyway, green tea is not included in the 5 Gs, just FYI. Increased bleeding risk can also be seen with the fish oils, more in the higher doses, vitamin E, and I'm going to butcher this. I don't remember how to say this. I think they said it's like donkey. Donkey. I'm so sorry. I'm just going to move on now. Willow bark, which is a salicylate, sometimes used for pain, and it's not to be used with other anticoagulants. I hope I made someone laugh today. My pronunciation of that other word. All right, dangers of herbal supplements, liver toxicity. So black cohosh, this is something that's used for menopausal symptoms. We also see, I think it's called chaparral and comfrey, and then kava, which is used in stress and anxiety, and then green tea. And so the extracts, which is like, I guess, the higher concentrations, and that might actually be a health concern and liver toxicity. So yeah, some of these natural products might actually be hepatotoxic. And yeah, that kava should not be recommended due to hepatotoxicity risk. So for cardiac toxicity, one of the big ones is ephedra or ephedra, and that was actually removed from the market because of it being such a stimulant and having that cardiac toxicity. I think that is one of the ones that you would see. I think it is very similar to phenylephrine, basically. And then bitter orange, also known as citrus aurantium or synephrine. And that's also a stimulant which replaced ephedra. It also has risks. So both of those have dose-dependent cardiac toxicity. They increase blood pressure and heart rate. And there are reports of myocardial infarction, stroke, and arrhythmias. So not something that's probably worth taking as an herbal supplement. DMAA, also something with cardiac toxicity. And then licorice containing glycyrrhizin, although artificial licorice flavoring does not contain that, so not something that has to be worried about. And then amphetamine, I'm not sure why I created a second bullet point right there, I apologize, is a derivative used in bodybuilding and performance enhancement. And then yohimbe, I think that's how you say it, used to increase libido and for ED. And then caffeine, usual doses are not harmful, but excessive doses have risks. And so that can raise blood pressure and increase heart rate. So, I mean, caffeine isn't all bad. It increases alertness, it helps with weight management, and can be useful in treating headaches. And then green tea might help lower LDL and triglycerides. So just the quantities, dose dependent for that one. Okay, so moving on to medical foods. So this is not a medication nor a supplement. And these are compounds consumed enterally to meet a nutritional need for a specific condition under medical supervision. Many are surprisingly non-prescription and not covered by most insurance plans. So we're kind of moving away from the dangers of herbal supplements now with this slide. So these ingredients must be generally recognized as safe, and they abbreviate that as GRAS, and they have to be approved food additives. I did find it really interesting that they're not covered by most insurance plans, even though some of these patients might be needing them administered, I guess. And the FDA requires medical foods to be taken enterely, taken under supervision of a healthcare provider, and intended to treat a condition with a known nutritional requirement. Other products like vitamin D, like cholecalciferol 50,000 units, is considered a medical food, as are many commercially available RX-only vitamins. So now we're getting into natural medicines. And I have 3 slides worth of these. So I have underlined the ones that are underlined in the RX prep book that they deem, I think, the most important to know. So for anxiety, valerian, passion flower, kava, and St. John's wort, although we want to avoid due to hepatotoxicity, have some other listed there. ADHD, they actually say omega-3s. Cold sores, we have L-lysine. Cold and flus, echinacea, zinc, vitamin C. Dementia, they say ginkgo, vitamin E. Depression, we see St. John's wort, SAMe, valerian, 5-HTP. And then diabetes, alpha lipoic acid, chromium, cassia cinnamon. Dyslipidemia, so red yeast rice, although not all of these over the counter are said to contain this lovastatin, so might not actually work that well. I mean, I will say, since I'm saying this, none of these supplements are actually proven to work anyway, and I think that we need more studies in this field anyway. I think that would be good for this field. Anyway, and then omega-3s. Dyspepsia would be calcium and magnesium. Energy and weight loss, bitter orange, although we have that synephrine component, could cause out those cardiac toxicities. Caffeine, guarana, green tea powder. Erectile dysfunction, ginseng, L-arginine, yohimbe, I think that's how you say it. Heart failure and heart health, CoQ10, hawthorn, omegas. Hypertension, we see omegas, L-arginine, CoQ10, and garlic. GI health, they say fibers, they underline that. Inflammation, they say omegas, flax seeds, and turmeric. For insomnia, they say melatonin, valerian, chamomile. Liver disease, they say milk thistle. For menopause, they list black cohosh, soy, red clover. Migraine, prophylaxis, feverfew, butterbur, magnesium, riboflavin, guarana. For motion sickness, ginger and peppermint. Osteoarthritis, the glucosamine, chondroitin, SAMe, and turmeric. Osteoporosis, they have calcium, vitamin D, soy. Prostate health, saw palmetto, lycopene. Skin conditions, tea tree oil, which be careful because that can dry you out pretty bad. And then UTI, cranberry, and yeah. Again, this is posted, and there's a lot. Just wanted to kind of quickly go through it. So as an overview of the vitamin supplementation, so people who consume an adequate diet typically do not require supplementation. Oh, sorry, we're going into something a little bit different now. Yeah. Calcium and vitamin D intake remains insufficient for most adults and children. Thiamine deficiency, which is B1, is common in alcoholism and malabsorption, including Crohn's disease, and this can lead to Wernicke's encephalopathy. Symptoms include mental confusion, ataxia, tremor, and vision changes. Anticonvulsants can contribute to calcium deficiency. And just as a little refresher, here are our vitamins. A is retinol, B1 is thiamine, B2 is riboflavin, B3 is niacin, B6 is pyridoxine. Again, the underlined ones is ones they want you to know. B9 is folate, B12 is cobalamin, C is ascorbic acid. Another one, so in case you want to memorize these, my way of remembering B9 is pregnant women need folate for their babies, and you carry a baby for 9 months, so B9, folate. All right. So let's see here. Low levels of vitamin D impairs calcium absorption. So calcium and vitamin D supplementation, product type is discussed further in this chapter of the RX Prep book. But let's see here. The American Academy of Pediatrics makes the following recommendations for infants and children. So exclusively breastfed infants or babies drinking less than 1 liter of baby formula, they do need 400 units of vitamin D daily. And then older children who do not drink at least 4 cups of vitamin D fortified milk also need supplementation. That's just a side note. And then as for folic acid, so deficiency causes birth defects of the brain and spinal cord. So it is imperative that mothers are getting this vitamin. So all women of childbearing potential should be obtaining 400 micrograms a day though. During pregnancy, it should increase to 600 micrograms a day. And this should be taken for at least 1 month before pregnancy, so preparing, and then continued for 2 to 3 months of the pregnancy. And then prescription prenatal vitamins, they usually contain about 1,000 micrograms or 1 milligram of folate. So for vitamin E, it's usually unusual to have a deficiency since it's present in a lot of foods, but patients should actually not take more than 400 units daily to avoid cardiotoxicities. For iron, we have the iron recommendations here. And then we have what breastfed and formula recommendation should be here. I'll let you guys look back at that. And then Ferrinsol and Feosol are some of the supplements that are available. They're the generics. And then vitamin supplements with iron, polyvisol or drops, and they have vitamin D and iron. And then we have some others like Flintstones, Pokemon, and then some other store brands. Here are some of the drugs that cause nutrient depletion that we always need to be aware of. I always think of those PPIs, metformin B12, loops, and then some of these other ones. And then conditions as well. So ones that we want to be aware of, alcoholism. So you always see that like thiamine, multivitamin, folate complex when, you know, people who are coming off of some binge coming to the hospital are getting this. All right, a rather exciting topic, CBD. And we're almost done with this presentation. So CBD, so this is found in the cannabis plant. Marijuana is a type of cannabis plant. This is the one that usually does not cause a high and does not appear to have physical or psychological dependence. However, THC, this is generally extracted from marijuana, and this ingestion may result in a high. CBD is used in a variety of health issues, some efficacy, some without. And those include childhood epilepsy, anxiety, insomnia, and chronic pain. It's generally well tolerated, but it can cause some nausea, diarrhea, fatigue, and irritability. And this is the prescription version that's available right now, and it's approved in childhood seizures. The legality is still confusing and it's still evolving, so we will be on the lookout for what happens with that. And as far as other homeopathic products, so homeopathic products in general, they're based on the belief of the law of similars, that like is cured by like. And so the belief that giving very small amounts of a substance, which is undiluted form, causes similar symptoms of the illness, which will protect the patient or cure them of the illness. The quantity of homeopathic substances in a product is reported in an X or a C dilution scale. So X represents a 1 to 10 dilution of solute to solvent, and the C represents a 1 to 100 dilution of a solute to solvent. And so 1X is considered low potency, and then 2X to 1C is considered higher potency. But the more dilute, the more potent a substance is, which is interesting. But homeopathic product manufacturers are permitted to make health claims compared to the manufacturers of dietary supplements. That is what I have for today. I hope this helped everyone. Again, these are taken from the RX Prep book. Hopefully this kind of was a good brush up. Hopefully you got some little nuggets of knowledge today, and that the pronunciation brightened your day. What questions do you have for me?